Good morning, I'm Frank Powers, and this is Lifestyle Tucson, the program where I speak to our neighbors, the people behind the scenes of our amazing organizations, small businesses, and nonprofits. Our friends are informing you how they serve our community, and they are here to give you updates on future projects. Let's make some new friends today. Gather round, children, it's story time. In 1967, while working for the Head Start program, Dr. John David Arnold wrote a grant proposal and submitted it to the Tucson War on Poverty program, which was funded by grants initiated by the Kennedy Johnson administration. The grant was funded at $19,000 and PEP was born. Dr. Arnold purchased a 1957 48-passenger school bus and equipped it with educational books and supplies. He painted it green and named it La Tortuga. He was the driver, mechanic, and school teacher all rolled into one. Having lived in Mexico, he knew firsthand what it was like in an unfamiliar society with a different language and culture. So he began teaching English and basic education in his portable classroom to the same farm workers he had ministered to in the past, helping them prepare for life in America by gaining a practical education. Hence, portable, practical educational preparation. From its humble beginnings, PEP grew and prospered, and today it boasts over 500 employees, making it one of the top 100 employers in Arizona. La Tortuga's legacy lives on, and Dr. John David Arnold, PEP CEO, continues to advocate for the poor and neglected citizens of not only Arizona, but the world. Every service PEP has provided to the over 4 million people over the past 40 years has been driven by Dr. Arnold's dedication and commitment. And we are lucky because today, I'm fortunate to speak with Amy Bass, Executive Director of Prevention, and Kate Meyer, Community Prevention Coalition Coordinator of Portable Practical Education Preparation. Ladies, welcome to Lifestyle Tucson.
Thank you so much.
I really apologize for stammering through some of that, but let me ask you this much. What's the inside lingo? Is it PPEP? Is it PEP? Or is it...
It is PEP. We say PEP. Back in the day, there were a few people that said PPEP, but it has evolved and it is PEP, PEP Inc. Mm-hmm.
It's an amazing organization. I dove into your website. There's a lot to find out there, and you can go online and get all that. I'll give you all the details on the website. Or actually, what's your website, just so people can know right off the bat?
It's real easy, Frank. It is ppep.org.
That's as simple as that.
Yep.
So I really invite a lot of people to check out your website because you're up to so much, so many programs, so many things, so many initiatives, helping so many people. And that's what's important to me because I was talking to you before. I was going to keep this little secret and surprise you with it, but you saw my glorious gold shoes and I had to tell you, I'm a children's entertainer. That's why I wear these shoes. And I drive around in a 1969 VW bus bringing education and art to kids all over Arizona. I had the same vision as this man, so reading all about what you are up to and how this organization has grown and blossomed over the last 40 years was the most awe-inspiring thing that I've seen because it shows me that I think I'm on the right path to helping kids and helping people get educated and believe in themselves and bringing portable education right to your doorstep. What an amazing thing to notice.
It is great.
That's amazing.
So, right? I know. Enough about me, though. Tell me about your organization. I gave a little bit of a history of it. Mm-hmm. But Amy, tell me all about your organization, and then we're going to get into and dive into some of the events you have coming up and some of the key programs that you want to talk about.
Sure. So PEP is very diverse, as you mentioned. We're not only here in Tucson, we're around the state and around the world. So you're right about Dr. Arnold. He really is a true humanitarian. And, you know, in addition to being just a great person to work for and a great boss for us, it is impressive, the work that he's doing. He's never stopped helping people and those most in need. And I think the rest of the organization kind of falls in under that in what we do. It's everybody is really committed. So if you look at the PEP website, you'll see things that are happening over in Ghana and Cameroon. And we just he just came back. I said we because I felt like I went with him. He took a lot of our information over there on opioids to Liberia. He also brings medical equipment down to the orphanages and the clinics in Mexico. There's work going on in Oaxaca. He's out on the reservations. He's everywhere, and he's a great leader. So we are happy to work for PEP. PEP has 6 charter schools around the state. So
Wow.
PEP Tech Education. We've got a developmental disabilities department. We've got daycare programs for disabled adults. We have housing programs. We have a medical supply services department. We also do microbusiness loans for people. But we are prevention. So I run the prevention department, and we're going to tell you all about that today.
It's really important because we're trying to help save a lot of lives. And the way to do that is through education and getting people the resources that they need so that they know that they're not going to fall into a trap, especially when it has to do with, drug addiction or opioid abuse or anything when it comes to, being a person and just getting through life the best way we can in a clean way. So tell us about what you're doing and what we're going to look forward to at your big keynote event that's coming on up.
Great, sure. So in the prevention department, and we also share some of the supports for people. We have other programs at PEP that are human resources, help with utilities, things like that, workforce development. So there's a lot on the website. But us in the prevention department, we really believe that if we can start early, working with kids, working with families, that we can prevent kids from starting drinking alcohol, using drugs, smoking, marijuana. I mean, we're always up against something, but now it has turned deadly. And you've heard about the fentanyl that's out there. It's getting laced into all the different drugs. And
It's terrifying.
yeah, it's very scary.
And I think about when I was growing up, and I think about watching my friends that have kids now and what it is to be like, I have my friends and they think that, weed's not a big deal anymore because it's legal or all these things. But no, there is really the dangers of you could be one and done. You could be a kid and think maybe this isn't such a big deal and everyone else is doing it here at the party. So maybe it's not a big deal if I do it. And that sort of peer pressure and things like that are the stuff that we need to help kids. There used to be a lot of programs like this that almost become parodied, like DARE or things like Being Scared Straight. But I think a lot of that information, just the honest information about the fentanyl being laced in drugs, that's going to scare someone straight because it's not just about, oops, I made a mistake. It's, oops, I'm no longer here. It can be a one and done situation with fentanyl. It's very scary.
And you never know, which pill has a deadly dose of fentanyl in it. You can't tell by looking at it if it's from a prescription or if it's an illicit drug manufactured by the cartel in Mexico. And they are just pumping the U.S. full of fake pills that people are taking.
Let me ask, do we have more of a surplus of that in the Southwest because of our proximity to the border? Do we have more of a problem than they might have, let's say, in the Midwest?
We do have quite a lot, but we just got back from the National Drug Summit, and every city across the country is reporting higher and higher overdose rates every year because of fentanyl.
It's shocking.
Frank, a lot of times people will think that, but in actuality, the HIDTA, the High Intensity Drug Trafficking Area, and the DEA, the Drug Enforcement Agency of the U.S. government, they will tell you that like 90% of the fentanyl coming into this country is coming in through legal ports of entry in commerce. So shipping containers, the big boats, it's in transit, and it is, they've got very sophisticated ways of disguising it. There is a very small percentage of the fentanyl that is coming across, being walked across the border by people. It's just, yes, some drugs come across the border with individuals, but the majority are being shipped to the countries.
Yeah.
By the truckload.
Yeah,
Yeah,
probably
truckload.
preconceived notions is why. I mean, again, that's why I thought of it. I was wondering if it was either going to have a dramatic effect where we'd have more, or because of proximity we'd have less. I was wondering if there was just going to be something like that. But finding out that's like, no, these things just coming over, shipped along with Amazon crates and whatever you're ordering from Temu and every other thing across the ocean. So that's fascinating to learn.
Yeah. And, also because anywhere that you are near a coastline, or any major commerce center, you're going to have more of it, but it doesn't stay there. It then gets further distributed. So places where you're lacking in the education or the awareness, like rural communities that you think would never be touched by, how did they get this? And so really it's about, I think a couple of things, or more than that. But one is you've got to get the information out there. People have to know about it, right? Secondly, if you're trying to affect kids and adults, parents, you've got to look at, are they having these conversations? A lot of teenagers don't go to their parents to solve their stress and their issues. They will go to their friends, or they will just try to find some outlet to resolve it. And so working with kids, working through the schools with their mental health, making it okay to say I'm not okay, there's value to that. Because there is a high performance pressure from parents and schools on kids. And if you're not doing well, is it a safe space for you to be able to talk to someone and get support?
Support's what kids need. And again, I remember growing up, and I even have a story about my sister where, again, I was very afraid of drugs. Because I was even told by friends growing up, they're like, because I'm a Jim Carrey style personality. And my friends would be like, I'd love to see you on cocaine.
Oh, gosh.
And it's like, well, you never will.
Yeah.
Because I was like, I have an addictive personality. I'm addicted to Slurpees. Like, I'm afraid if I would go down that road. And I was afraid. And it's something that we all have to acknowledge. Every child's going to come to this fork in the road in their life. Every teenager will get offered drugs. It is a part of life. My sister had a similar experience where she had the cocaine, but she had it home, thinking of if she's going to do it. And she was in the bathroom alone. She goes, what am I doing? Right? Where it's up to you to make that choice. And she took it and flushed it down the toilet and never did that. She never did that. But she remembers and thinks about that day. And she says that day that she remembers, she goes, I don't know what the other fork in the road was, but that was a fork in the road in my life. It's fascinating.
Frank, you just said something in your own story. You said, I know myself, or I knew myself. And I think that's key. It's important for these developing individuals, these young folks, for them to really know who they are. And there is a lot of pressure out there with the social media to be more, to be better, to be this, to be that, and always trying to achieve something else. And I think one of the things, Kate, she's done a lot of work with kids around the arts too, is to help them really identify who they are and value that. And I love your story because you said, I knew myself. I know I shouldn't do this, but you knew yourself.
Yeah. And more importantly, I knew my flaws. So I'm teaching now too. I get to teach some high school kids, and it's great because a lot of things that I do when I do teach kids, it's a lot about, we hear about identity politics a lot. And a lot of that, sometimes it's having to do with gender or sex or something like that. And I say, no, that's actually not what it's entirely about. I realized my identity in 7th grade when I realized I was the art kid. And then I started to champion that and lean into that. Like, I am the art kid at school, and he's the football kid, he's the basketball kid, she's the really nice girl, that's the hippie-ish girl. Like, you can actually really find that you do have an identity. And it was me trying to escape being the nerd kid, the kid that was always beat up in every sitcom, and kid was always picked on in every movie, that like, you don't get the girl. I had to fight against that. And I did that by saying, I'm going to make sure I'm not the nerd that is ostracized. I'm the art kid that's elevated. And I really leaned into that and started to become that. Yes. And that's what I try to teach kids. Try to figure out what you want to be. Are you an engineer? Do you love computers? Even if you love video games, you can chase that as a career now. There's a lot of opportunities for kids, and having a clear mind and not being addicted to substances, and especially making it through these tough high school years, is important. That's what's important. Let's talk about what is really important and getting together and talking about this together on Thursday, April 25th. Tell me all about what we're doing on Thursday, April 25th. It's the Opioid Misuse Prevention Symposium.
This year's theme is Building Bridges, Prevention Through Recovery, an evidence-based practice, a sequential intercept approach, which is a lot of words to say, but we are going to be talking about all different kinds of modalities, about prevention, intervention, harm reduction, and treatment, and how we meet people where they're at these different levels of intercept to get them the services that they need, whether they're a young child who hasn't tried anything yet, or if they're an at-risk population of youth that might be thinking about using or have dabbled, to people who have unfortunately broached into like a full-on addiction situation, and then all the way through recovery, people that are trying to find sober living and peers to spend time with so that they can maintain their recovery.
Very important. Getting a new social circle is huge when you're trying to get out of a bad social circle of people that aren't, on the same path as you. They can be holding you back. That's very important. Tell me about our keynote speaker, Laura what's her name?
It is Gover.
Okay.
Yep. Sometimes we want to change that and stick an R or an
Yeah.
L in there, but no, it's Laura Gover. And I will tell you that my first acquaintance with the rescue agency was out in San Diego. And I don't know if you remember this, but there was a turning point in our advertising. It used to be, we'd advertise a product, and the ad would be about the product. Like if it was about ketchup, it would be, what great ketchup it is. Now you see a lot of the advertising and there is a cause attached to it, or there's a human story. It's something about us being better individuals. And then at the end, the ketchup appears.
Right.
And they make the connection. And that's when I first met Rescue Agency. They're doing that. They are seeking to change behavior through marketing and for the better, health-related changes, quit smoking, get healthier, exercise, don't, use substances, just everything you can think of. And they have a brilliant team. I was just so taken aback. I came back to Tucson and I collected my staff. I'm like, you guys have to go to this. It's the best. And so they do it every other year. And in 2025 will be the next one. It's in San Diego. And we're bringing in Laura from the rescue agency as our keynote speaker. And that's where people can become more familiar with the rescue agency and how that can help them learn ways to promote health-changing behaviors. So really excited about that.
That is huge.
One of the great things about Rescue is that they're not just doing this for their own profit. They're really branching out and working with coalitions across the country and helping them with their marketing strategies and helping them come up with effective behavior change, social marketing for the people of their own community. They do surveys, they do evaluation, they help with the messaging. It's a whole package deal with them.
That's wild. Networking is the key to success, obviously. I talk about it all the time. Tucson's a great place for networking to get things done. It is. I always say it's the baby bear's porridge. It's just right. Aww. So that's right. So that's the thing. The fact that you're connecting with a lot of the nationwide prevention programs as well and getting the education from everywhere to figure out these models, using, again, just statistics. That's just the thing you got to use. Just getting feedback, surveys. What do people actually need? Not guessing. Getting that real feedback. And that's really important. I just want to touch again. This is going to be Thursday, April 25th, all day long from 8 a.m. till 5 p.m. at Desert Diamond Casinos. Make sure you go down and check out the Opioid Misuse Prevention Symposium. Get some help for yourself. Get some help for a loved one. But the important thing is get all that information. So tell me more. What can attendees expect at the symposium?
Well, the symposium is open to all. It's open to anybody that is interested or cares about the issues that are going on with the opioid epidemic and helping support friends, family, the community, people that work in the field. We have people from the medical field, law enforcement, schools, teachers, parents. Yeah, so just about everybody. And when they get to the symposium, in addition to these great speakers and this wonderful information, there's also opportunities to visit the vendor booths. So we still have vendor booths available. They are $250, but we have moved the vendors inside the symposium, so they actually get 2 free seats at the symposium. And it's a great way for people to share their organizational information with the attendees. So there'll be that, and then we're going to do a nice breakfast. There'll be lunch. I think this year we're having a burger bar. Yeah, so you can build your own burger. There's chicken burgers, beef burgers, veggie, every kind of burger that you can imagine. So that'll be fun. And just, I think, also being a part of this solution, being part of what can we do? I am so tired of hearing story after story of parents who have lost kids who have just gone to a party and tried a pill or, taken another drug and it's laced with fentanyl. We should not be losing people like this. And so getting on board, we have one of the highest demographics of people who are overdosing is actually older adults. And when you think about it, older adults, they get pains, aches and pains. They get prescribed opioids if they're not careful on how they're taking them, or they run out and somebody offers them something else. Hey, this is the same pill. Take it. I got it from a friend. And if it's got the fentanyl in it, that could be the end of them. So it's just really scary. So I think it's going to be a really good day, really good information. I know great food, great networking, vendors will be there. And Kate, what else? What else? Did I miss anything?
So we're going to be showing the documentary Dead on Arrival, which is about 4 individuals who took fentanyl-laced drugs and passed away, unfortunately, and it's interviews with their parents.
Yeah.
And then we'll
I'm
also...
sure that's hard-hitting.
It is really hard-hitting. It's a very moving film. We also have local experts coming to talk to us about their programs in a panel called Yesterday, Today, and Evidence-Based. We have folks from the county and the city and TPD talking about programs that they use in the schools. We have a session on trauma-informed harm reduction. And then we also have another panel called Alternative Paths to a Common Goal, where we're bringing together people from faith-based, 12-step, and MOUD, which is medication-assisted treatment for opioid use disorder. And they're all going to be discussing their different ways of helping people find recovery. Our last presentation of the day will be Treatment of Acute Pain in Patients with Substance Use Disorder, a perspective of a surgeon and an internist. And those are from some of the doctors over at Tucson Medical Center who are not only sponsoring the event, but also have been on the planning committee with us.
Huge. I'll tell you what, the one thing I can guarantee that's going to happen at this event, and I know this sounds like it might be a lofty thing to say, but it's not. You're going to save some lives.
Yes.
That's a guarantee. Mm-hmm. It's a guarantee that someone out there that's listening or someone that knows someone that is going to bring them, they're going to save their life. Mm-hmm. So you should look into attending this event. It costs $65, but there are some scholarships available at the registration site, so maybe you can get on in there if you meet the needs. And yes, a lot of the symposium information and money is going to go to what cause? What does the money go to?
Well, we got to pay for the event first. And beyond that, if there are additional proceeds. So right now we have some great sponsors. Desert Diamond Casino and Pima County Health Department have both stepped in as major sponsors, and they've contributed $5,000 each. We also have additional sponsors, of course, PEP, Tucson Medical Center, Banner Health Systems, COPE, Kodak, CMS, and others. We're really pleased, but if we can pay for the symposium, because it does cost, right? Then the proceeds will go to our 2 youth coalitions that directly serve youth, the Be Free Pima in South Tucson and the Amato Youth Center in Amato.
Yep, I was going to ask you some questions about them as well, those groups, but I just think I'm going to have some more folks from your great organization come back to talk about all the great fun stuff that you're doing. Plus, people got to make sure they go online to that website and check out Dr. John David Arnold's Royal Nigerian Chieftaincy Ceremony.
Yes.
I watched that video last night. Yes. This man's changing the world, and you're changing the world too, and you're doing a lot. So if you want to go help change the world with these lovely ladies, head on down to this amazing organization's event Thursday, April 25th at the Desert Diamond Casinos from 8 a.m. till 5 p.m. There's going to be breakfast, burgers, and all this fun stuff. You can go get all the information at www.pimacpc.org/RX Symposium. You'll have to look up how to spell symposium on your own. We don't have enough time to spell it for you here. Today, I was fortunate to speak with Amy Bass, Executive Director of Prevention, and Kate Meyer, Community Prevention Coalition Coordinator over at PEP. Thank you for joining me today, ladies.
Thank you, Frank. Thank you for having us and helping us get this information out. It's so needed.
Thank you so much.
This was Lifestyle Tucson.
Awesome.
Bing bong bing. Time for a great recap because this is a great organization, PEP. They've got a lot of resources on their website, and I really enjoyed talking to my guests today because you can tell when you really are speaking to someone that really cares and is tenacious about caring and helping. And that is certainly what I was experiencing today. And you can go get all the details over at ppep.org because their website has a lot of links, very colorful, a lot of information, but more importantly, a lot of programs. Again, they have micro lender programs, diabetes prevention education, organic farming awareness, clean water programs, and just a lot to learn about. Even deforestation has a link, and they're really just trying to help a lot of stuff here locally, but also around the world. So it's a great organization to get involved with, maybe volunteer, perhaps donate. Think about how you can help PEP because I think they're an organization certainly worth helping, and they are going to be, I think, a more frequent guest here on Lifestyle Tucson because there's all these great little branches of PEP where I'll be able to talk to different guests and different things that they're working on. So let's talk about what we did talk about, or let's recap what we did talk about today with the Opioid Misuse Prevention Symposium happening Thursday, April 25th from 8 a.m. to 5 p.m. It's an all-day event. You can go get all the details at pimacpc.org/RX Symposium. The keynote speaker, Laura Gover, is going to be there talking all about how you can get any information for building bridges, prevention through recovery, evidence-based practice, and sequential intercept approach when it comes to helping people get off opioids. So really important stuff here. If you know someone in your life that needs this help, or maybe you yourself need this help, the first step is admitting that you have a problem and that you should attend this event. So do that. Maybe think about it. Think about what you might need to learn about yourself or about someone else that you can help, a friend, a loved one, a sister, a brother, maybe even your parents. Oh goodness, I hope not. But either way, there's organizations in town to help, and PEP is certainly one of these great organizations. So I want to thank our new friends at PEP for joining me today. You've been listening to Lifestyle Tucson. If you're a nonprofit that would like to be on the show, email lifestyletucson@gmail.com. For more information about this program or to listen to something you may have missed, go to the Sunday Mornings page on klpx.com, kfma.com, mixfm.com, or espntucson.com. You can also subscribe on iTunes, Spotify, and Audible, or wherever fine podcasts are helping people out. Follow on Facebook, YouTube, and Instagram at Lifestyle Tucson because I'm your BFF, your best Frank forever, Frank Powers. Toot toot Tucson. I love you the most.